How often do you see people like this in your chair every day in your practice? And the interesting thing is, none of these patients ever really asked for orthodontics. In fact, most of them were just suffering from continual tooth chipping, bits and pieces breaking off their teeth slowly over the years, the teeth gradually degrading. Now, the reality is many of these cases would still, by many dentists, be treated restoratively only. That's actually a mistake. These patients all need orthodontic treatment combined with restorative treatment, meaning that really every single dentist should be able to offer a little bit of orthodontics to make these cases easier to complete. We can use SureSmile combined with restorative dentistry to help patients improve the final outcomes and ultimately prevent things such as long-term full mouth rehabs. This patient, with the amount of wear she was experiencing on her anterior teeth, was certainly heading for a lot more treatment further on down the line. And there's many dentists right now who perhaps would have treated this case, certainly anteriorly, using ceramic veneers upper and perhaps lower. And all we've done here is straighten the teeth, whiten the teeth, and add a little bit to the edges, and ultimately becomes very predictable using SureSmile Aligners. And the reality is, I did this sort of treatment for many years, and the more you treat patients with repeatedly chipping front teeth, rather like you see on the left side, and you align them and you straighten them and give them the right overjet, the right overbite, the right envelope of function, you will see these teeth become far more stable. And this is actually of a huge benefit to many patients. And the best thing about ortho-restorative thinking is that you do end up treating lots of your own patients because your patients become more educated and understand what is slowly happening to their teeth, such as this patient who, through every checkup, we were talking about what was happening, how his bite was slowly deepening, how his dentin was starting to wear, etc., etc. This patient eventually realized for himself why he needed to have his treatment done. So we went through the SureSmile treatment, but ultimately what I would say is that many of the patients that I treat using SureSmile Aligners are actually patients that have been sat in my chair for the last 10, 15 years, and it's just been done through simple communication and education instead of me having to try and sell some kind of treatment to them. And I believe that that's actually a far safer way to practice. So I hope from that little introduction you can start to see that moving teeth is not just for orthodontics, it's very much for restorative dentistry too. And with digitally planned orthodontics, we can get better occlusion and long-term function. If things aren't digitally planned, we're really guessing where the teeth are going. We don't really have the control that we need. So how do we help you do this? Well, education is important, of course, and support is equally important. You want to be learning what to do in a good way, but then also have your hand held and be able to ask all the questions you need to make sure your cases run smoothly. IAS is an international faculty of general dentists and specialist orthodontists, and our goal is to teach safe orthodontics and restorative dentistry together because we believe in adults that these things really go hand in hand to make sure you get good occlusal and functional outcomes. The course program that we're going to run is the SureSmile Aligner course. It's an online program that I've written and has been translated and will be delivered by many of our mentors and trainers from around the world. Fundamentally, there is a recorded online component that is given first of all. Then a hands-on kit is sent to the delegates and you'll receive that kit, and then we will run together through a live online hands-on session where I'll do some demonstrations. You'll have the kit, you can do them there or on the spot if you want to, or take them back to your clinic and do some IPR, do some attachments. And then we can actually assess that for you through our mentoring support site, where you also will have ongoing full case mentoring as well. And this really provides a good support system to make sure that users start their cases well and successfully.